So tell me a little bit more about your treatment experience. As Dr. Nikita Williamson talked about, there are lots of new treatments, and there are different types of breast cancer. She had a triple negative breast cancer, which is more common in African American and underserved communities. It's also more common with patients who have the BRCA-related gene. And overall, these patients who have triple negative cancers do have a worse prognosis, worse survival. And so it is extremely important to actually detect and treat a little bit differently than those patients who are hormone positive, for instance. So would you care to share about your experience with chemotherapy as well as immunotherapy?
Yeah. So this all started with chemo, which when you hear chemo, you always think, oh God, my hair's gonna fall out. What can I do to stop my hair from falling out? That's the only important part about this. I was looking forward to not having my hair fall out. It fell out. But I think initially we were still trying to figure out what stage I was in. Initially, there was a chance that I was stage 4. So we had to do a lot of, more tests to kind of make sure that was the case. I had some amazing physicians, my oncologist, of course, my breast surgeon, taking a look at a lot of things, and then eventually I was diagnosed like stage 2. But still, there was some question of where it came from. So Dr. Shana put me on a very intensive round of chemotherapy that included like weekly infusions of chemo the first 12 weeks. And then the last 4 weeks was very intense chemo. Throughout that time, I had immunotherapy every 3 weeks, which was going to be followed by radiation and continued immunotherapy for another 9 months after that. I think initially I thought that was like, wow, that's a lot, but I put everything into Dr. Shana's hands, and yeah, it was tough. I had a lot of support. I came with someone every week. My hair did fall out, but I was able to work still some, and it was what it was. But it is challenging because when you're used to working out, doing stuff that you're used to doing, it is not that easy to do anymore. So I am lucky and blessed to say that that part is over. I feel great. I feel healthy, and as my doctor, Dr. Rozelle, told me, that I will get through this, so I'm cured.